I'm Dr. Ole Jensen, and I've got Dr. John Kim with me from San Francisco, a very prominent prosthodontist. And the subject matter that we've been having lately is how patients should decide on treatment and which doctor to see and what to do. And so Dr. Kim's very experienced, had a long track record in treating complex problems, which is what a prosthodontist is. So I'm going to ask him a few questions about how patients should evaluate their own care and what to do. And Dr. Kim, do you think patients are capable of deciding for themselves what treatment they should have? For example, let's say they wanted to have their teeth removed and exchange and have a full new complement of teeth. Do you think patients are capable of making that decision?
Well, not 100%. I think it normally driven by person or doctors or surgeons.
Mm-hmm.
But luckily we have a digital technology, something related to what we call restorative driven surgeries that I'm pretty much like it.
Right. So you're looking at when we say restoratively driven, that means can the teeth be fixed so that we can go forward without taking the teeth out. What makes for teeth that can't be fixed? So let's say somebody is wondering, should I just give up and start over and get my teeth out? Is there a point of no return, and what is that point of no return where the teeth should be removed?
Well, there's a lot of issues that I'm thinking of right now, but I think first of all, I think for aesthetic purpose, I think their muscle shrinks, and then appearance is different. So I think if any patient or anyone who wants to change their looks, appearance.
So aesthetics is really important.
Yes.
And that's a fair thing. So, and that's a very personal thing too, isn't it? So if you yourself, you think, man, I don't look good. I should look better. That's a valid criteria for going forward. What else is something you think about?
I think second comes from function. If they don't eat well, they think if they don't eat well, that means they probably having not healthy. So I think that comes second.
I remember my parents, when their teeth were failing, they had a lot of pain. They couldn't chew. And so that was kind of the reason that they went forward. So a patient who their teeth don't work well together, or they're uncomfortable, or maybe they're missing so many that they're missing, there's gaps, that starts to be a reason where you consider removing your teeth. How about anything else?
Well, I guess, that's comes from maybe from aesthetics or function, but interrelationship between their society or their community. They feel they want to involve some community with good looks. Maybe that comes with the old.
Right. So that's very interesting. Let's call that connectedness.
Connected, yes.
Yeah. And the opposite of that is being isolated.
Yeah.
So if someone's ashamed of their teeth, the way they look, or they're not being social, they're hiding, they're hiding when they don't want to smile, that social reason, that becomes another decent reason to make a decision one way or another. So that's really, really interesting. So those are kind of the reasons maybe to get you to go see somebody like Dr. Kim. But Dr. Kim, can we trust dental implants now? After all, it's not me, it's not my original teeth. Are they good enough to replace my teeth? Can we trust dental implants?
Well, so far we got all the literatures, journals, and actually follow all the case that I have done so far. We have some good numbers of success rate.
Mm-hmm.
So I think besides the dental implant, I think I don't think anything else right there.
Yeah, in dentistry, the dental implants might be more successful than any other kind of dental procedure that we do. For example, let's say dentures. Are implants more successful than dentures?
Yes.
In other words, dentures, we do them and a lot of times they work out and they hold pretty good, but there are a lot of patients, the dentures float around. And it's, you must admit they're not successful.
Yes.
So that's one thing that's good about dentistry. Anything else you'd like to say about what goes into the decision? How about the doctor's intuition, your feeling, your diagnosis? You also have an opinion about what might be best for the patient. How do you go about explaining that to the patient?
Well, that's pretty not easy question to ask, because every doctor has a different scale of learning or knowledges and technique. But I think that's why we have to learn. That's why we go for more advanced training and then reading of journals and knowledges. We like to adaptation from previous doctors like Dr. Jensen or all those good mentors. Without keeping up all the data that we're having, so many data we're having these days, I think we cannot really give them a best quality of treatment and best quality of life.
Right, so not to pat you on the back too much,
Okay.
but your opinion really would count because you're a prosthodontist, a specialist in this kind of work, right?
Mm-hmm.
So if you give an opinion about what could be best for a patient in terms of going forward with implant treatment, your opinion would be one of the best in the world, wouldn't it?
I hope so.
Thank you, Dr. Kim.
Okay.
Enjoyed talking to you.
Okay, thank you.
You bet.
Wow. He's wonderful. He's good. Oh my, you might change your life chapter now.
He's
Oh
going
my
to be a
God,
star
he's
now.
He's
Huh?
good, isn't he? Yeah.